my name is Jennifer. I'm will be your student nurse today. Can you tell me your name and date of birth, please?
It's Allison. My date of birth is 4/28/1966.
Okay. And can you tell me what's brought you in today?
Well, I've been having some anxiety, which it seems like it's been getting worse lately. It seems like I'm having more shortness of breath, more heart palpitations. I'm having some problems concentrating. So it just seems like it's getting worse.
Okay. So what are you, what's happening prior to you start having those symptoms?
Well, I've had a lot of life changes. I've recently lost my job, and that's really been stressful. We've, of course, having some financial difficulty because of my loss of my job, and so that's really kind of, made things rather difficult.
Mm-hmm. So what I'm hearing you say is you're got a lot of anxieties due to, your loss of job here recently and some other situational things. So have you seen your doctor here recently?
I seen my doctor about a month ago, which I was having anxiety symptoms then, and it was sort of my normal regular checkup. But I have lost my job within the last month, so I feel like, my symptoms have gotten worse.
Okay, so your doctor's appointment was before the loss of job, am I understanding that correctly?
Yes.
Okay. Have you made contact with the doctor's office since that situation has occurred?
Well, I made an appointment, but, they've put me another month out. I usually see my doctor once every 2 to 3 months. So, that's why I was seeking help here at your clinic, since I felt like the symptoms were getting worse, until I could get in and see my doctor, next month.
Okay. So does he have you on any medications or anything that have seemed to help you in the past, or anything in the past you've done?
Yes, he does have me on some medications for anxiety. I'm on a couple different medications. I take Lexapro, and it's my understanding it's for depression and anxiety, and that seems to be helpful. But I've been on that same dose for about 20 years.
For 20 years?
Yeah.
Okay. So, is there any other type of things you do to help kind of reduce your anxiety when that seems to come up, or?
Yes, when I'm having one of these panic attack, usually if I just sort of sit down and relax and listen to some calming music, that seems to help my thought process. It kind of grounds me a little better. I feel like it helps me get through that situation.
Okay. So, if you're open to some other plan ideas, we can give you some other measures to help with that. Would you be kind of open to hearing some other measures that possibly could help with your anxiety?
Oh, absolutely. I would love to have some other ideas on how to help with that.
So, there are some what's called deep breathing exercises. So, we could expand on that some and get you, trained on some of those. Just, help deep breathing, help relaxation like that. There's also activities and stuff. Any hobbies or anything you enjoy?
I do. I live on a farm, and I enjoy my farm life, especially being outside with my pigs. I have a lot of pigs. Even though it's sort of a job, work-related type thing, it's still, in my mind, a hobby because, I enjoy it. I don't think of it as work.
Yeah.
And then I do have some other animals that I use that kind of help with my anxiety. I have a dog that is he's a therapy dog, so he seems to help.
Does he?
Yeah.
Okay. Well, so interacting with your animals, if that seems, to help your anxiety some, I definitely, still encouraging that. I would also still encourage, if the listening to the calming music helps, we can look at doing the deep breathings along with those other measures. And then we can also, since you've been on that same dose for about 20 years, we can talk to your doctor about possibly maybe making an adjustment there and see if that kind of helps you along those lines. And then, of course, if talking to somebody helps, you can always come in for more sessions, or we can even set you up in a group session type setting, just whatever your needs are there, whichever you're most comfortable with. So we can kind of go, we have multiple paths that we can go down, but ultimately it's just whatever you need and what your comfort level is.
Okay.
So,
I think the group sessions would be beneficial.
okay,
I enjoy talking to people, and I think, that would be good.
okay. So we'll definitely look into those, and I will get you information on those.
Okay.
That way we can get you set up with the appropriate groups and, at the appropriate times for you, whatever's going to work best for you. And, at any point you feel like you need to come in and talk some more, you can always come in, you can call and we can set you up for more sessions. Or if you're good with your, weekly sessions or however that lands, then we can continue on that. Just like I said, however you need to do that, whatever's best for you. So, do you have any further questions or anything else I can attempt to help you with today?
I think that's everything. How often do you think the therapy sessions, are those like once a week or twice a week? Or
So it just depends on at what you need, basically. There's some people that just do them once a week. There's some people that do them a couple times,
Okay.
so it's just however frequently you feel like you need them. So, I mean, we could always start out at like twice a week, and then if you feel like you're doing better and you want to try to drop down to once a week, we can do that. Or if you feel like, your anxiety's getting worse and we need to meet a little bit more often, we can also up it from there. Just whatever you feel like you need.
Okay, yes, that sounds perfect.
Okay. Any more questions for today?
No, I think that's everything.
Alrighty, well, I'll get that information to you and we'll see you next time, okay?